Hi everyone, my name is Nafil. Welcome to today's training video for nursing assistant. In today's session, you will be learning how safely to assist a patient when they want to walk towards the washroom from the wheelchair. These are some of the important skills that a nurse assistant should have to maintain safety and security to the patient. So don't forget to watch this video till end.
As we move on, Section 1. Assisting from a wheelchair. When a patient calls for assistance from their wheelchair, the first step is respond promptly and calmly. Approach the patient and communicate clearly. Explain that you are there to help them stand and walk safely. And also remember, before you touch the patient, to perform the sanitization process. Alright, so as we move on the video, ensure the wheelchair is stable and brakes are locked. Place the patient's feet flat on the floor and close together for balance. Secure a gait belt around the patient's waist to provide support. Stand in front of the patient with knees slightly bent and back straight. On the count of 3, assist the patient to stand using the gait belt or controlled by the support. Once they are standing, guide them slowly towards the washroom, keeping yourself close and maintaining support through the gait belt. Always observe the patient for balance and signs of fatigue and adjust your support as needed. Safety and communication are the key throughout this process. After demonstrating this transfer, my students will now practice in technique under supervision. Each student will assist a patient from the wheelchair using the gait belt, ensuring proper posture, controlled movements, and patient communication. This hands-on practice helps to build confidence and skill in real-life scenarios. Next, using crutches. We will introduce the crutches as a mobility aid. Proper use of a crutches is essential for maintaining balance and supporting a patient's independence. Teach the patient to hold the crutches on the stronger side of the body. The crutches should stay on the stronger side. When walking, instruct the patient to move the crutches and the weaker leg forward together, followed by the stronger leg. Also remind the patient to maintain an upright posture and a body balance to prevent from falls. Remind the patient to be careful on uneven surfaces, wet floors or carpets. Teach them to look ahead and not just at their feet. Encourage the patient to keep their eyes looking ahead, not only at their feet. This helps to maintain balance and prevent injuries or accidents. Remind the patient to avoid rushing during this process. After the demonstration, my students will take turns assisting and guiding the patients using the crutches, practicing safe mobility techniques, focusing on the correct posture and the correct walking pattern. During the practice, pay attention to the body posture, patient communication, and safe walking pattern. This hands-on training allows my students to apply what they have learned, build confidence, and develop the essential skills required for safe patient care as nursing assistants. So guys, we have covered essential nursing skills that is required for a patient's mobility and safety. And also you have guided the proper way walking safely to the washroom and body balance and mobility. By practicing these techniques, nursing assistants can provide safe and effective compassionate care. Thank you for watching my video, and for more useful tips and healthcare related videos, don't forget to subscribe my channel and press the bell icon.